I am Dr. Narasingan, physician from Chennai. I am the Vice President of the World Hypertension League. I am really very happy to get associated with the Third World Congress on Cardiometabolic Medicine, which is happening in Mumbai. I have an important guest with me, who is the President of the World Hypertension League, Dr. Paul Whelton. And he is actually involved in so many trials, and he was responsible for coming out with the guidelines in the management of hypertension in the year 2017. Whatever the trials that have been done in the field of hypertension, I think it is commonly seen that his name figures all the time. That shows the interest in the field of research, in the field of hypertension. I am really happy to have you with us this afternoon to have some sort of discussion for the usefulness of many people, particularly the healthcare providers. I think the hypertension is responsible for increasing the cardiovascular morbidity and mortality. We know people who have an uncontrolled hypertension can go for stroke, heart attack, heart failure, kidney failure. It is not uncommon to see patients with atrial fibrillation, peripheral arterial disease, or even the aortic dissection. Yep. But we need to concentrate at another important point, like the dementia, the cognitive dysfunction, which is not being addressed routinely, but it is not uncommon to see people, even in the middle age, when they have an uncontrolled hypertension, getting into problems of dementia. Right. And I think if hypertension is not detected early, if it is not prevented properly, they get into complications. That's the important message. What I thought I should probably share it with you. With your vast knowledge in the field of hypertension, I am tempted to ask certain questions. Do you think that the current recommendations of 140/90 systolic and diastolic blood pressure should be the threshold to detect hypertension, or you still prefer to use the one that has been recommended by you during 2017 guidelines 130/80? Yeah. What's your comment on that?
Well, first let me say what a pleasure it is to be with you and to be with those of you watching The Right Doctor. And, 140/90, it's okay. I don't think it's right, because I think people at lower levels of blood pressure, especially if they have other cardiovascular risk factors, need to be treated, and treated more intensively. But of course, as you well know, the big problem overall is we're not detecting and treating people, and people who are being treated are not being treated very well. So we have a huge problem. It's one of the most important risk factors for all of the things you mentioned. And now when we reflect after many years, we have made some improvements, but a lot of what we recommend from the trials and guidelines, it's just not being implemented. So we have to step back and say, how can we do this better? Because it's a terrible shame. This is a very treatable and very preventable disorder, and it really shouldn't be the way it is, whatever country we're in. Some countries are doing a little better than other countries, but worldwide, none of us are doing great. So I think that's the big message, that we need to redouble our efforts, and we need to really think about how we implement what we all agree we need to be doing.
I think during our conversation you mentioned about how to prevent hypertension. Will you be in a position to tell us what to do to prevent the onset of hypertension?
Yes, there are many things that are associated with blood pressure. And then the next level is to look at clinical trials. What has been proven to be beneficial? And there are always things that are on the margin. But of the things that are very, very, very well demonstrated, I would say a healthy diet. All healthy diets lower blood pressure. And there are many different forms of healthy diet. Physical activity. And there are many types of physical activity, but the one that most of us think about is what we call aerobic physical activity. That would be brisk walking or running or dancing or swimming, or those sorts of exercises where you have a lot of movement. But all forms of exercise are beneficial. Reducing sodium intake. It's a big problem worldwide, and of course a very big problem in India, where we have very high sodium intake, and we know that that leads to age-related increases in blood pressure, so that's an important one. And we have good trials for replacement of sodium with potassium in salt. We know that that approach, where you replace the sodium by reducing it about 25%, it's been well proven to prevent stroke and other cardiovascular outcomes. Enhancing potassium, which we get from fruits and vegetables and some of the leafy products, very healthy, and it's best done by diet. It's, again, extremely effective for stroke. High potassium intake, people are much less likely to have a stroke. And then we get to things like alcohol. And if you don't need to drink alcohol, it's better. If somebody is drinking alcohol, there's a graded relationship. We just published a big pooling of studies that basically shows from one drink all the way up. You've got a pretty continuous relationship worldwide. So we generally say in men, you know, in the US in our guidelines, we generally say no more than what we call 2 standard drinks, which usually is less than what most people consider when they pour a drink. But 2 standard drinks a day, and for women, 1 standard drink a day. But if you don't need to take alcohol, it's better. So those are things that are very well proven. Now, other things, stress reduction, nobody wants stress. And there are studies, and there are great believers in stress reduction, and maybe it works, but it hasn't been proven as well as some of the other things I mentioned. And there are a multitude of other suggestions. But the ones I mentioned, the 6 things I mentioned, are the ones that really are by far and away the best proven. And they're very effective for preventing the occurrence of high blood pressure, or at least delaying it. And they're very effective for treating high blood pressure on its own or in combination with medications.
What type of diet probably you would recommend? There are various types of diets people are trying to practice. For example, Mediterranean diet, DASH diet,
Yeah.
Paleolithic diet, or the vegetarian diet, vegans. All those things are now confusing the people, not only the
Yes.
doctors,
Yes.
but also the people who are taking care of themselves for the treatment of hypertension or prevention of hypertension. They get confused.
Yeah.
What type of diet, as a president of the World Hypertension League, which one probably would you recommend?
Well, I would say all the ones you recommended are pretty much heart healthy. You know, so they tend to go more towards fruits and vegetables. They tend to avoid some of the, certainly the animal fat products, and you can become stricter, but they're all heart healthy. The DASH diet is a dietary approaches to stop hypertension, which was formulated specifically to try to lower blood pressure. It's a good one. It was developed based on many of the studies we did early on to understand what worked. So it's a good one, but it's not the only one. And I would say if somebody wants to be a vegetarian and they do it properly, great, that's wonderful. It's probably good for their heart, and it's most certainly going to be good for their blood pressure as well.
What's your comment on sleep disturbances and the sleep apnea connected with hypertension? Do you think that controlling the hypertension in people with the sleep apnea by adopting various techniques, will it produce a cardiovascular benefit?
Yeah, well, certainly there's a relationship, and it's a complicated relationship. And people who have sleep apnea do tend to have more likely to have high blood pressure. Many of the interventions for sleep apnea have been tested, and they don't seem to be terribly effective in lowering blood pressure. There may be a reason to use them for sleep apnea per se, but they've been looked at for blood pressure quite carefully, and that's not a solution. So if somebody has hypertension with sleep apnea, it needs to be evaluated, and it probably needs to be treated either with lifestyle changes, or more likely the combination of lifestyle change and medication.
There is always a controversy by using a pharmacological agent, particularly in the field of hypertension. Which one to be chosen? Which combination should be ideal? Because different guidelines give different instructions, or the guidelines are trying to probably favor 1 drug or 2 drug combination, single pill combination. But I would like to ask you specific questions. Among the diuretics, which one probably would you prefer, or what had been recommended in 2017 by your guidelines?
Right.
Do you think that the chlorothalidone is better when compared to hydrochlorothiazide? What's your take on that?
So I would say that the overall take is that High blood pressure is what the body recognizes, and that's the risk factor. And any combination of drugs, sensible combination of drugs that lowers blood pressure is probably a good combination. There are drug-specific differences, but the main element is getting blood pressure down. And if we're going to use a diuretic, we traditionally have used shorter acting diuretics like in the United States, hydrochlorothiazide, and still, just because of culture and commonality, that's what most clinicians are still writing as a prescription. But the better approach, I believe, is a longer acting agent. And there are two main ones that are out there, chlorthalidone, which I personally take to manage my blood pressure, and indapamide. Some countries
Europeans use indapamide.
yeah, some countries have indapamide on their formularies,
Yeah.
and they don't have much chlorthalidone. And U.S. and India tend to have chlorthalidone on the formula. Chlorthalidone is very nice because it's truly a once-a-day drug, and it gives good coverage in the nighttime. And we know that office blood pressures are the most important because they've been used in all the observational studies and all the major clinical trials. But having said that, you and I both know with monitoring blood pressure throughout the day, that blood pressure measured during the night is a very important indicator of risk. And controlling that blood pressure during the night is probably very important. And chlorthalidone is likely to do that much better than a shorter acting agent. So I much prefer a longer acting agent.
What is commonly seen in our country is the combination of diabetes and hypertension. It not only increases the morbidity but also mortality when these two problems are encountered in an individual.
Yeah.
Do you think that we should probably concentrate on those people with hypertension complicating diabetes, mainly on ARBs and avoiding ACI? Do you think that ACI also has got a good data to be used as a first drug in combination with the CCB or in combination with a diuretic?
Yeah, I think sadly we commonly see people these days with many risk factors together. They're like a group of thieves. They tend to travel together.
Yeah,
so when blood pressure shows up, you know, anyone ought to be thinking, are the other culprits there? Because they probably are. And maybe they're in early stages, but high blood pressure is very often associated with overweight, and then it can go to the next stage of obesity, and with that comes cardiometabolic disorders, the common one we classify as diabetes, and that combination is a terrible combination. Throw into that mix lipid abnormalities, and worse still, somebody smoking, and the risk just gets higher and higher and higher. And we see complications, clinical complications, earlier in life when there's multiple risk factors around. So I do think very close attention to the management of patients with the combination of high blood pressure with other risk factors, and especially diabetes, since it's such a potent risk factor. When it's there, all of these risk factors are not equal. Diabetes is a very, very potent risk factor. So I think trying to manage it,
Yeah.
not only managing the blood pressure, of course, but there are other ways to manage the diabetes with agents like the SGLT2 inhibitors. They're not really antihypertensive agents. They don't meet the criteria in our country for the FDA to classify them as antihypertensive, but they do have a little blood pressure lowering effect, and they surely have very beneficial effects on the heart and the kidney and probably on the brain as well. So,
Now, let me ask the final question. I think we are now trying to conduct this World Congress on Hypertension in 2025. What do you expect in India to conduct this conference in a bigger way? Or do you think that we need to probably concentrate on paramedics and other people for the prevention of hypertension? Or you would like to give the message only to the doctors? What's your idea about it?
well, first off, I must say I'm really excited. This is the first time we've had this meeting being held in India. It's going to be a major meeting. You obviously have put an enormous amount of work into it with your colleagues in the Indian Society of Hypertension. So really exciting. And the type of people who are coming to this meeting are the very best people from all over the world. So I think it'll be a great meeting to start with. I think we have to say everyone has a role in blood pressure. They have a role in recognizing it. Maybe it's not yourself, but it's your parent or it's your friend. We all have a role in trying to help to recognize it. Obviously, healthcare professionals can really help then to pin it down and categorize it. How severe is the level of high blood pressure, and what are the most appropriate recommendations? Is a lifestyle on its own likely to be enough? Or for many people, of course, it's going to mean lifestyle plus some medications. But we have a huge task. The way we've been trying to do this, and I think everyone has been sincerely trying to do their best, hasn't worked very well. So that means this is a very important inflection point, and I think the meeting next year will be very important. And how do we take what we know for prevention and treatment and actually implement it? I think that's our big challenge worldwide now, and in the meeting next year we'll have a big focus on that, as well as on measurement of blood pressure and how to do that well, and how do we do it with the rapidly changing options that we have for measurement of blood pressure. So I'm very excited about the meeting in Chennai next year.
I'm really happy that you had actually taken some time to give us some interview during World Congress on Cardiometabolic Medicine, arranged, executed by Dr. P.C. Manoria with the help of TheRightDoctors. I think we had given lots and lots of messages. We have heard so many good messages from Dr. Paul Whelton. Thank you very much, Paul Whelton. So
it's
nice.
My pleasure.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.